today. Today is 29 June 2018 and I'm meeting Dr. Geetha Manjunath, who is the founder and CEO of NIRAMAI Health Analytics, which is working on new ways of doing breast cancer screening. And we will talk about a little bit about breast cancer in men. Breast Cancer Hub that I'm representing, and it talks about both women and men. So let's discuss a little bit about breast cancer in men, Geetha. So how is your screening process working with breast cancer in men, and what is the awareness situation of breast cancer in men in India, and do you get frequent patients with male breast cancer?
Yeah, hi Lopa, wonderful to collaborate with the Breast Cancer Hub Foundation, and I'm very glad to hear that you're actually catering to both women and men having breast cancer. Breast cancer in men is of course a much lower percentage compared to women. The known number is 1 in 1,000 in India would have breast cancer in men, and but unfortunately many male colleagues and friends don't know about this. There's always a surprise element when we tell this in a forum, in a talk or something like this. That's one thing, right? But for example, last year there were 364 men detected with breast cancer in UK alone, right? It was a big number, right? But in India, these numbers are not very much available. Typically, what happens is men don't detect it when there is an abnormality in the breast, but it gets metastasis and then it goes to the lung, and that's when it's detected, right? That is bad, right? If it is detected early, even men can get away with this horrendous disease of breast cancer. There is some level of shyness of saying, how can men have breast cancer? I have met, in our own tool, maybe let me talk about what we do, right? NIRAMAI has a new way of doing breast cancer screening, which is completely non-contact, non-invasive, and no radiation. So we just keep a thermal imaging device 3 feet from the person and then take the temperature variations on the chest remotely. What this means is this is completely applicable to men as well, right? There is no like 2 plates like mammography. You don't need to put your flesh out there and so on. It's just remote, just like a photography session. So it is amenable to men. We've done over 2 dozen men who have gone through our test. We have found 2 abnormalities. Basically, these 2 men came in because they found some kind of a lumpy structure, and we haven't found any cancer, thankfully, so far. It is a small sample. Having said that, I personally believe that just like when a person goes for an executive health checkup, he goes for a chest x-ray, he goes for a blood test, he goes for a diabetes test, go for a thermal scan of the chest. It doesn't have to be called breast cancer. It doesn't have to be called breast screening, right? It's a chest thermal screening which can be done, and a tool like our tool is basically artificial intelligence based, so it's extremely objective assessment of the thermal analysis, no guesswork, nothing. So a report is generated, which can be used as a health score of your chest region, right? Just like X-ray would have a chest region. So, I personally believe that both men and women have to do this test every year and save themselves from the horrendous disease called breast cancer.
Wow, amazing. So I would like to let you know, Geetha, like Breast Cancer Hub, we are also collaborating with Male Breast Cancer Coalition.
Okay.
So they are a huge foundation in US, and they are working tremendously on breast cancer in men, because the Brett Miller, who is the founder, he is actually a breast cancer survivor. So I would definitely would request you that if you come across any breast cancer patient, please recommend them about Male Breast Cancer Coalition. That way, no man who goes through this turmoil should feel alone, because they have so many survivors on their web page, and they have so many advocates, and they are so reciprocative, so it will really help them.
Sure,
so,
we will definitely talk about the coalition and the effort that you're doing.
Definitely. So that we just wanted to let you know, because we are working on male breast cancer too.
Yeah, definitely.
And thank you so much, Geetha, for the wonderful, and thanks for your time.
Thank you so much, Lopa.